To add to what Howard said, we are looking at how patients will perceive these therapies and the needs that they have. And as someone who is at risk of developing ALS or FTD, my key focus is on how we can be as adaptive and caring as possible. Unfortunately, we really cannot accelerate the delivery of these therapies to patients because we do have to go down a regulatory pathway where we ensure safety, efficacy, all of the above. But I think that what we can show is that we have people who are incredibly committed. Howard and I both have personal stories. We are personally vested in bringing these therapies to patients, and we are pursuing our next trial as fast as possible to get patients in, to stop the progression of their disease, and to hopefully change the future of what these patients experience when they're diagnosed with ALS.
Is the word starting to get out a little bit? Are people starting to ask about it?
100%. So I field our emails that come into our website, and it's constantly patients saying, how can I have access? Especially after we released our proof of concept data of Coya 302 and ALS. Never before had patients seen a therapy where progression was nearly stopped. Most studies in ALS are done over 6 months. We performed a study of 4 patients over 48 weeks, and we stopped progression to negative 1.5 points on the ALS FRS score. That is in comparison to some drugs that are approved, where at 6 months, they only stop progression to negative 7 points. So you can see why the excitement, why the fervor is there. And we want to be able to do everything we can to bring that solution to them.